You know, when we think about a broken bone, most of us picture a cast, maybe some crutches, and a few weeks of just taking it easy. But what happens when the injury is way more than that? We're going to go beyond a simple fracture and dive into the complex, high-stakes world of severe bone trauma and the incredible science that puts it all back together.
And that's really the question, isn't it? We're not talking about a little crack you get from falling off your bike. We're talking about a bone that shatters, a bone that actually breaks through the skin, opening a direct gateway for a whole cascade of really bad complications. In these cases, the break itself, that's just the first domino to fall. I mean, just look at this image. This is a bone dealing with something called chronic osteomyelitis, a deep, nasty, long-term infection. See how swollen and warped it is? That is the kind of thing that can happen when a bad break takes a really bad turn.
Okay, so let's start this journey right at the beginning. The moment of injury. The moment a normal fracture becomes something way more dangerous.
This is where our story kicks off, with what's called a compound, or an open, fracture. And just like it says, the bone is now exposed to the outside world. Now think about that for a sec. The sterile, protected environment inside your body is suddenly open to dirt, bacteria, everything. The clock is officially ticking.
What's really fascinating is how surgeons assess the damage right away. They use this system, the Gustilo classification. A type 1, that's like a small, clean puncture. But as you go down the list, things get bad fast. By the time you hit a type 3C, you're looking at a catastrophe, massive tissue damage, and a torn artery. At that point, surgeons aren't just fixing a bone. They're in a flat-out race against time to save the entire limb.
And the response has to be just as intense. This is not just putting on a splint. We're talking a full-on, multi-step emergency protocol. It starts with resuscitation, controlling any life-threatening bleeding. But look at steps 4, 5, and 6. Decontamination, tetanus shot, and antibiotics. The battle against infection begins the second that patient comes through the door.
But here's the thing. The danger isn't just coming from the outside. The body's own reaction to the trauma can create this hidden and honestly terrifying emergency inside the limb itself.
And this hidden danger has a name: compartment syndrome. Imagine the muscles in your leg are bundled into these tight packages, right? And they're wrapped in this tough tissue that doesn't really stretch. Well, after a huge injury, that tight little package starts filling up with blood and fluid from swelling, and the pressure inside just starts to skyrocket. And this diagram shows the vicious feedback loop that kicks in. It's awful. The injury causes swelling. The swelling increases the pressure. That pressure starts squeezing off the blood supply. So the muscles and nerves, they start to starve for oxygen, which injures them, which, you guessed it, causes even more swelling. This thing just feeds on itself, and if surgeons don't intervene, the tissue will literally die. So how do doctors catch it? They look for the classic 5 Ps. And that first one, pain, that's the big one. We're talking extreme pain, especially when you gently stretch the muscles. Pain that's way out of proportion to the injury. The other signs, paleness, that pins and needles feeling, paralysis, they all tend to come later. By the time you get to a pulseless limb, it is an absolute disaster. All right, let's fast forward. Weeks, maybe even months, have gone by. The immediate dangers are hopefully over, but a whole new struggle can pop up. What happens when the bone just gives up on healing? This is called a non-union. The definition says a permanent failure to heal, but I like to think of it like a bridge. The two ends of the bone are like two sides of a canyon. The body is supposed to build a bridge of new bone to connect them, but for whatever reason, the construction crew just packed up and went home. Months go by and the x-rays don't lie. There's still a gap. And a whole bunch of things can cause this. This slide breaks it down into 3 main categories. You've got patient-related stuff, like their age or if they smoke or drink. Then there are injury-related things, like if a big chunk of bone was lost or if that open wound got infected. And yep, even the treatment itself, if it wasn't stable enough, can stop a bone from healing right. And what's interesting is that not all non-unions are the same. A hypertrophic one is like the body is still trying but failing. You can see the bone ends are enlarged, they're biologically active, but they just can't make it across the gap. An atrophic non-union, on the other hand, that's like the body has just completely given up. The bone ends get all rounded off, and that whole bone-making process just seems to have shut down. So now we come to what is often the most dreaded long-term problem. An enemy that sets up a fortress right inside the bone itself. A deep, stubborn, and dangerous infection. So how does this fortress even get built? Well, it often starts right here, in the metaphysis. That's the area near the end of our long bones. See that hairpin arrangement of the blood vessels? The blood flow there is super sluggish, kind of slow. It's the perfect spot for any bacteria floating around in the bloodstream to get stuck and start to multiply.
And as those bacteria multiply, the body fights back with inflammation, which creates pus. That pus starts to build pressure. It spreads down the core of the bone, and it also forces its way out through these tiny channels, getting underneath the periosteum. That's like the living skin that covers the bone, and it just lifts it right off.
And the result of that is absolutely devastating, as you can see here. That periosteum is where the bone gets a lot of its blood, so when it's lifted off, that section of bone is starved of blood and it dies. This piece of dead bone, now just floating in pus, is called a sequestrum. It's basically a permanent hideout for bacteria and a physical wall that makes healing impossible.
Okay, I know. This cascade of problems sounds completely overwhelming. But for every one of these complex problems, modern orthopedics has come up with an absolutely ingenious solution. So let's look at how surgeons fight back and literally rebuild the human frame.
The solution has to be an aggressive surgical attack. A sequestrectomy is the operation to go in and get that piece of dead bone out. The hole that's left is often filled with a bone graft, usually taken from the patient's own hip. A non-union gets stabilized with plates and screws. But maybe the most incredible tool of all is the Ilizarov method. That external cage of rings and wires, it doesn't just hold the bone still. By turning those dials just a tiny bit every day, surgeons can slowly stretch the fracture site, tricking the body into growing brand new bone to fill huge gaps. I mean, we're talking about creating inches of new bone out of thin air. It's amazing.
So from an open wound to a vicious cycle of swelling, from a bone that gives up to an infection that builds its own fortress, the journey of a really bad fracture is a tough one. But it's a journey that's met at every single step by incredible human ingenuity. It just goes to show you that while our bodies can be fragile, our ability to understand them, to rebuild them, and even regenerate them is truly extraordinary. And it really makes you wonder, what will we rebuild next?